Hi everyone. I guess it's good afternoon, isn't it? Yep. Life has been a bit fast this morning. Okay, so thank you for the invitation to be here. And thank you, Ingrid, for the invitation as well. So I guess I'm just going to give you a little bit of an overview of my life and how I've got to where I've got to. I work at Peter Mac as a medical oncologist, so I see patients twice a week, and also I have a lab there of around 15 people. Where we focus on trying to understand how the immune system interacts with breast cancer. So this is a bit of my background. So I was a medical doctor, I trained at Monash. Just reflecting back, I guess, in high school, I went to Caulfield Grammar, which was traditionally all boys, and I was the first entry of girls. And I personally think there's some advantages going to a co-ed school. I was very good at maths, and I was in a class with all boys. And that, when my colleagues talk about going to all-girls schools now, I think it was actually quite good to be in an environment where all boys, I was smarter than all the boys. But at that time, I thought about doing at that time, and still, I guess, traditionally male-orientated careers such as engineering and chemistry, and I was quite discouraged to do that. So I was basically encouraged to do medicine, which I ended up doing. Not that I regret that, but at the time it was very much, girls do medicine, boys do engineering. And I would probably say that still holds a little bit to today, though probably is less. I went to Monash as an undergraduate. I know now many careers are postgraduate. I think there are some advantages and disadvantages of doing it as an undergraduate career. I was very young at the time, so by the time I finished my physician training, I was not yet 30. So I think that gives you quite a few advantages with regards to overseas travel. I did my physician training at the Alfred and then on at Peter Mac. I would say that, at the Alfred, I noticed that many of the male consultants were largely male, and when I went to Peter Mac, my consultants were largely female, and I think that probably had quite a good influence on choosing a career forward at the time. And I would have to say at Peter Mac, I did see lots of my colleagues, mainly female colleagues, drop out and did not pursue advanced career or research. So, I'm going to talk a little bit about that later on. I went overseas to do a PhD and postdoc. This was largely accidental that I chose Belgium because I didn't want to go to London. I like to ski, so I wanted to go somewhere close to the mountains. So when people talk to me about choosing where to go, I would also encourage you to think about where you want to be. Some people want to go to certain cities. I think this is all very good options when you're younger to live in a city that you want to live in. Because you don't have that opportunity anytime soon. So I went to Belgium and I could stay a long time overseas because I had no children at that time and a very small mortgage, and I worked for a great female boss. And I think this has been largely very influential. And I stayed there for close to 10 years and I had 2 children during that time. And I came back to a full-time group leader position at Peter Mac in 2013, and I was full professor by 2016. So just again, reflecting on this, my boss in Belgium was full-time, and she very much encouraged me to continue to work full-time, though when I came back, there many of the female medical oncologists were part-time and still are part-time. And I would say that whilst it was very hard to have 2 young children doing a full-time position, that got very easy once they kind of reached 10, 12 years old and could walk to school. So for all those of you who are contemplating having children, it's definitely doable. And that time of hardship is, I would say, quite short. Peter Mac is a very outward-looking cancer hospital, and I think that's quite different to some of the other big academic hospitals in Melbourne. Might be different now, but I think Peter Mac was always, being a relatively new specialty cancer, I think they were very open to having a diverse group of people in their medical oncology faculty, and that may be different for some other medical specialties. And the breast unit I worked for was very female dominant, and again, this is very unusual for many medical specialties. And actually the head of medical oncology for breast was the first female medical oncologist in Victoria. So I think again, I think coming back to role modelling and mentorship, these facts are very important. You basically can't be what you can't see. So I think this is a very important message for people going forward and choosing their careers, who they're going to work for, and the organisations they're going to work for as well. So what I focused on for my research was trying to understand breast cancer and immunology. And I would say that through my PhD in Belgium, I was given many opportunities that I took advantage of. It was a very new area of genomics research, and I guess I didn't even know what, gene expression really was at the time I went, but I had the feeling that technology would very much influence medical research, and I really wanted to learn about new technology, genome-wide technology. It was really the start of genome-wide sequencing at the time I went overseas, and I wanted to know how to incorporate that into medicine. So I've chose, it was a very vague idea that I had, that I read a few New England papers and Nature papers, and I thought, oh, this sounds really cool. Didn't really know what it was, but I was given the opportunity fortuitously by my boss in Belgium, and she had a project that had a funded fellowship position, so that was also important, and I worked for her trying to get genomic technology to the clinic. So she was very translational. And she gave me a lot of opportunities to also do my own research projects on the side, and that's how I began to realise there was an impact of the immune system on breast cancer, which was a new thing back then. And we developed a biomarker, and we also developed new targets, and that's led to a lot of internationally recognised biomarkers, as well as practice guidelines, as well as new drugs that are now approved in Australia for the treatment of breast cancer as well. And that also gave me the opportunity to bring clinical trials back to Australia, which I did with these new immunotherapies. And, Peter Mac was one of the first centres in Australia to treat breast cancer patients with immunotherapy. So that was really all very exciting. And, it's all very challenging as well, very enjoyable to see your therapies work on patients. And you learn a lot on the way. So I think this is the advantage about being a clinician as well as a scientist. As a scientist, you understand how to do research, and how to gather the evidence to formulate hypotheses and to understand if your hypothesis is correct or not. But as a clinician, you get to see what happens in the patient. And, medicine is very complex. And I think this is the advantage of being a clinician, because you see patients. So you're not just working as one system, you're working as a patient as a whole. And patients are, they're very diverse, as you know. And I find interactions with scientists, the team effort is very advantageous, because, you have my colleagues who work on one type of T cell for the last 20 years, and they know a lot about that T cell. But I can tell you that T cell therapy, does not work in this particular patient, and this drug doesn't work. So it's a matter of trying to understand, how your two observations can meet. And that's the advantage of being a clinician and a scientist. So from my point of view, it's a very interesting job. Like, I see patients, as I just mentioned. So that allows me to try and understand what happens in patients and bring that back to the lab. So that's, I feel, what I do as a clinician scientist. A lot of scientists do the other way around. They start on a type of B cell and then they move into the clinic. Whereas I try and understand what's happening to a certain therapy from a patient and bring that back to the lab. I also run a lab, which means my life is very busy. So I would say I'm a pretty organised person, and I'm not such a control freak that I don't mind delegating out to people. So it's very much a team effort. And running a lab means organising and managing people and students. So, I make sure I have lots of people that can help me, but it again requires a lot of interactions with people. So I have to understand both science and the drug development space. So that kind of is a little bit challenging from just a general knowledge point of view. I also have a lot of flexibility in my working hours, but as I do a lot of international work, it also means hopping on a Zoom at 10 p.m. at night. So there are advantages and disadvantages about that. I'm at the cutting edge for many new cancer therapies, so that's exciting. You can give treatment to a patient and if it's working well, and that's really exciting. And you also know if it's not working well as well. So that helps inform some of the things we do in the lab. And also there's lots of new technologies now. The technology advances have been incredible. Just in the time I've done my PhD, we're working at the single cell level. It's really incredible resolution to try and understand cancer and cancer biology. And so I think that's just going to get even more complex and even more massive and challenging. So again, as a clinician, you're trying to put this all together, and it's very advantageous to have the advantageous, in my opinion, to have the big picture, and then as well looking at the little picture, like single cells, and trying to understand how single cells relate to patients. I travel a lot and I meet lots of interesting people, and I like to talk to people who are specialties in other areas that I like. So, I understand that the disadvantage of being a clinician is also that you're a jack of all trades. You don't really understand one particular area very well in science. And so I kind of, like to phone a friend, so I like to phone people who are experts in a certain area to try and help me understand if my hypothesis is on the right track. Of course, some of the disadvantages of being a scientist is that you're working in predominantly a grant-funded area, which is competitive, and so it means that your job is almost never done. You're always working. So thinking about grants, thinking about new projects, thinking about where the money's coming from. So I think can be quite stressful, but I would argue that's the same for most of science that does research, and that is something that hopefully might change in the future, I'm not sure. But this is the world that we live in at the moment. It's a competitive environment. But the job is challenging, and it requires teamwork. And I think, one thing I'm just going to talk about briefly, if I can, is, at the when I first began, there were very few women at my level, but now, which was a pity because the majority of medical graduates when I graduated were women, right? But there were very few women, at my level, which is the professorial level, at least in cancer, when I became a professor in 2016. And so I'm just going to talk briefly about that because we've done a little bit of work about that as well, and we've done that with the Global Institute of Women's Leadership in Canberra. So I'm just going to talk a little bit about that if I can, just to try and get some of you a little bit, a little bit more insight into some of the roles that you may choose or have chosen in the past. And also then you can maybe think a little bit about that. So some things I've observed is, why am I the only woman in the field? Like, at the table, sometimes I'm the only female there. And, when I started to read into this, there's this book by Sheryl Sandberg, and she tried to understand why women don't lean in. Women are afraid. There is a negative vibe about women who have careers. They don't sit at the table, they sit outside the table. Next time you're at a meeting, just try and look at that, do they sit at the table or they sit around the table? There's an issue sometimes with women being successful versus being likable. And then what about mentorship? Is it hard for women to find mentors? Some women just opt out, they go and have children and then they work part-time and never ever get back into their career at the level of their male colleagues. Or they have partners who expect them to be at home and carry the burden of childcare. And also there's this myth, I certainly think that at the time I was coming through, there was certainly expectation that women, were required to do it all, do up the children, pick up the children, carry that burden as well as having a full-time job as well. So there's an expectation that if you want a career, you have to do everything else as well. But I think, the problem with books like Sheryl Sandberg is this places the onus on women and ignores the structural biases in organisations and the culture in leadership in these large organisations. And this promotes that it's an individual issue. Let's send all these women to leadership courses rather than an organisational issue. So there's some work that's been done, and I think this is something good for all women as well as men to know. And people argue that gender equality in the workplace exists because of women's decisions around ambition, work-life balance, and their decisions to make sacrifices. So people believe that women have less ambition, people believe that they prefer work-life balance, and they believe that women are less likely to make sacrifices for their career. So is this true? And so this is some of the work that we've been partaking in with the ANU. So, do women have differences in ambition? And so the work across a number of male specialties argues that at the start, so as they enter their first year in their careers, they have equal the amount of ambition as men in their first year. But in this particular context, so these were surgeons, you can see that by the third year, women have they've dropped off in their ambition to move forward compared to men. And if you look at this cohort, which was a large cohort looking at the sciences and life sciences between men and females over 3 years, again, they found the same thing, that at the start, women had similar ambitions to men in going forward in their careers, but by the time after 3 years, their ambition had dropped off dramatically compared to men. So, the fact is they start off wanting to do big things, going forward, doing research, really developing their careers. By year 3, that all has dropped off. And so what were the reasons behind this? And they did surveys with regards to work-life balance, and the willingness to sacrifice, and they found exactly the same thing, that everyone started off the same as year 1, but by the time they got to year 3, women had really dropped off, particularly in the male-dominated specialties like surgery, veterinary science, also police officers, orthopaedic surgeons, things like that. And so they tried to understand the factors that led to them dropping off. And what they found was that for women, the reason why they dropped off is because they found that they didn't fit with people further up the ladder. So when they looked up, the majority of the leadership were male. And so they found that, they were incompatible with what they saw the leadership of their organisation or the leadership in their respective fields that they were interested in. So they didn't look like them. So fit and belonging really predicted how far or how much ambition or work-life balance you're willing to have as you went further along in your career path. So basically what I'm saying is that women's ambition or expectations of work-life balance or willingness to sacrifice are really related to their feelings of belonging and expectations of success. So they're less likely to have ambition if they see that at the top they're less likely to get to a leadership position or higher up in their organisation. So the decisions on whether to go forward really depend heavily on this belonging and context. So from my point of view, my message to you is it's about role models and fitting in, and also attainable role models. And organisations, need to provide this culture that fuels this ambition and work-life balance. So they need to provide the role models that people can look up to of all different male, female, all types of people that people need to have a good team. And so the bottom line is organisations need to provide women something to lean towards. And so my message to you is as you go forward, find an organisation, find a mentor that really celebrates you and not just tolerates you. You want to find an organisation that really fits with what you want to do and people that in the leadership at the top that you feel that you can relate to. So I guess as a conclusion, my life as a clinician-scientist has been very rewarding. It's a lot of fun. I deal with lots of interesting people. I see amazing things. And, science is an amazing place to be at this point in time, I think, and it's only just going to get better. Human disease is very complex, and scientists and clinicians absolutely need to work together to work things out. Absolutely. I think teamwork is absolutely necessary to go forward, and clinicians see the big picture as a patient and how things can be applied clinically, because unless you have that clinical context, it's very difficult to understand how a biomarker can go from the lab right up to, approval into a diagnostic. And scientists also have lots of advantages because they see the small picture, the mechanism and the biology and how that fits in. So absolutely, science needs both. And if you're a clinician, you absolutely do need teamwork and you need to collaborate with many people. So this is just part of science now. It's big science, it's teamwork, and really you need to, interact with a lot of people, get along with people, respect people, and then be interested in what they have to say. And I would suggest to you that as you go forward in your careers, find a great organisation and institute, and also find a great model as well. And also just, as you make your own choices in your career, also reflect on why this might be so. Some people, when they do have their children, they opt to work part-time. I'm not sure that that's a great idea, but, that could be, are you doing something that your mother did? Are you doing something that everyone expects you to do? So really reflect on what is the expectation of you as opposed to what you want to do. And this is why I support quotas, diverse panels, and gender-blinded interviews and CVs, etc. So just have a little bit of reflection of how you make your choices and why you make your choices as you move forward and choose your career path. But, life as a clinician scientist is very busy, but it's certainly very rewarding, and it does give you a lot of flexibility to understand science and medicine as well. I speak from a cancer point of view. There's plenty of other things happening in neurology. I think it's going to be huge in the next 20 years. Obviously, there's COVID and other pandemics, medical technology, AI. The future is very broad and very exciting. So, there might be lots of things that you guys can think you have thought about, especially when you're much younger than we are. So, there's lots of things I think now that are very different in the next 20 years compared to when I was going through. So, be creative, and, do what you want to do as opposed to do what's expected of you. So I guess that's my main messages.
Well, thanks, Professor Loi, for that wonderful talk. I might open the floor to some questions first.
Thank you for your talk. It was absolutely wonderful. I just wanted to ask, obviously you have been able to achieve such amazing things, and I wanted to see how you were able to balance that with everything else, everything outside your personal experience, and what you recommend for others to, I guess, aim for high highs, but also be able to balance everything.
Yeah, lots of people talk about balance, but what is balance, right? So balance is a very personal thing, right? I'm personally quite hyperactive, so I like doing a million things at once. But some people don't like that. I think when people talk about work-life balance, it tends to be very female-focused. Okay, so again, I think that comes back to gender stereotyping, society expectations, your expectations, maybe that's what your mother did, worked at home. So I think that's, again, it's a very contextual, cultural, type of stereotyping. So I would suggest to you, actually, if you want to have a good career, your life is always going to be somewhat chaotic. But your chaos is good, right? So it's a privilege to have pressure. So, I'm very busy, but I'd rather be busy and people wanting to speak to me than no one wanting to speak to me. So I think that's kind of like a privilege to have that pressure. And I think that's a good thing to think about as you go forward. Sometimes your life is going to be very chaotic, and, choosing a good partner also helps as well. But, it depends on what you think is balance, I guess. And as I said, people talk about having children and working part-time. I'm not sure that's a great idea, actually. It also, while people talk about flexibility in the workforce, flexibility with time, that also allows you to step out a little bit. And I'm not sure you can ever regain that time back. Whereas if you, have an equal partnership with your partner, and your organisation is flexible about the times you work, I think it's probably preferable, actually. And also, just from a side point of view, you do lose out on a lot of financial benefits once you start working full time. You have less super, so just things like that, which put you at a disadvantage, essentially. So in Europe, women work full time. Yes, this is a very cultural thing to work part time in this country. So when I was in Europe, they're like, oh, what do you mean you're going to work part time when you have children? That's a very, it's a very cultural thing being in this country. So I was quite surprised about that because, I was like, most of my colleagues started working full time after they had their children. But you don't need to do that. It's busy, but it's a very short time in your life. If you're living to 80 and childbearing, the busy part is 10 years of your life, it's not a big part of your life, right? Mind you, my children are nearly 17, 18 actually. I can't wait for them to get out of the house, but it's a very busy time, but it's a very short period of time of your life. And then what are you going to do after that? So I think you have to find something that you really enjoy doing, and then that'll carry you through.
Big old hand in the air there with this.
Thank you for your talk. It was really inspiring. I just wanted to know your opinions about exploring the breadth of the breadth of your work, as in how you talked about being a scientist and working in a lab and doing epigenetics and stuff, and also being a clinician, and so you're doing lots of things at once, and versus just being a clinician to focus on treating patients and just delving deep into something versus having lots of things to do. What are your thoughts on that, and which one is a priority for you?
So you could be a clinician researcher. So you do clinical research, which it can be clinical trials, for example, or can be understanding clinical questions, can be, or you can do, a very fundamental lab-based research as well. In the end, I don't think it's very difficult to be prescriptive when you're so young. You kind of have to explore multiple areas and work out what you like and what you want to do. It's very, very broad when we talk about research. So it's really a matter of trying to dip your toes in and seeing what you like. So when you're a clinician, I think it's still important to see patients, but there are some clinicians that don't. So they train as a medical doctor and then they don't see patients after a certain period of time because they want to do science and they can't focus 100% on science. My work is very translational, so it's an easy kind of, it makes sense to see patients. But if I was working on fundamental T-cell biology, I don't think I would be seeing patients. I like working on drug resistance and drug markers or new targets, so that makes sense because it's a very translational part of medicine. So again, it really just depends on what you want to do, what interests you, and you have to kind of dip your toes into a few different areas before you find that. Doing science or honours or PhD is a good way to do that because you get a good 2 to 3 years, 4 years to really understand what it is that you're doing and whether you like it enough to take it forward into the future. I have lots of clinicians who do PhDs who go back to being a full-time clinician, but they're very helpful because they understand research. And so when there are research projects around, they contribute to research, they can actively participate, it's bi-directional, etc. So, there's lots of people, you can do a PhD or research and then go back to being a full-time clinician. It really just depends on what you want to do.
I might ask a question, I think, for the stage that possibly most of our audience is in comparison to us later. And then obviously, from your point of view, there's a reduction probably in the degree of external reassurance and sort of validation that we get from those around us sometimes, outside of meetings with mentors, etc. On a difficult day, after a difficult on-call, on a difficult ward, what are your strategies and how do you get through those harder moments?
Yeah, I do a lot of sport. So I play tennis, so I have a lot of outside interests apart from medicine. The things that make you happy, you kind of have to work that out. For me, it's social interaction, doing sport, etc., and having other interests. So, having a life away from medicine is important. Any big job is stressful. You can't go through life being stress-free, but it's just a way of managing that and putting it in perspective. And then, talking to friends and colleagues is a way of just, getting it out, rather out than in. So everyone knows, I guess, or has a way of de-stressing themselves. And it's good to learn that early on when you're quite young. So learn the best way to de-stress, I guess. See movies. I like movies. Go to the pub, things like that.